A good day. My name is Floris Schreuder. I work as a vascular neurologist at the Radboud University Medical Center in Nijmegen, the Netherlands. And I'm here today with Professor Mikael Mazighi, who works as a professor at the Hôpital La Riboisière in Paris, France. We'll talk about the results of the ACTIMIS study, which evaluated the safety profile of Glenzocimab, I have to pronounce it correctly, which is a novel antithrombotic, and they used it in patients with acute ischemic stroke treated with alteplase. Professor Mazighi, I'm really interested in your study, and can I ask what was the main question that you wanted to ask in this study? Which question did you want to address?
So with this study, really the main goal was to address the safety of this antiplatelet therapy, which has a very specific profile, again with an antithrombotic action, but without any effect on hemostasis. So in theory, without any bleeding risk. So it was very, it was fundamental to evaluate this new drug. This is a first-in-class antiplatelet agent in patients that receive reperfusion therapy, including IV TPA and mechanical thrombectomy for half of them.
And mechanical thrombectomy was used in about half of patients, you indicate. And there's been, of course, last year quite some results on whether or not to move to direct thrombectomy or use the combination of treatments. Do you feel that the population you included in the ACTIMIS study reflects current practice in Europe?
Sure. So in this study, we had a mix, again, for the phase 2A part of this trial. Only half of the patients were treated with mechanical thrombectomy, and on top of IV TPA, and half of them had only IV TPA. So it's not really a study only on patients with mechanical thrombectomy. So the mean NIH score was 12. These patients were, quite old, with a similar age that we can see in the studies evaluating acute reperfusion therapies. So I guess, yes, this reflects the populations that we are currently treating in this setting of acute ischemic stroke.
And the primary outcome of the study was safety and mainly intracranial hemorrhage. How did you investigate intracranial hemorrhages, and which kind of criteria did you use? Did you use standard imaging to detect any hemorrhages? Could you reflect on that?
So yeah, that's a critical point indeed. So this was mainly CT imaging at 24 hours. And we used the Heidelberg classification to classify all the ICH, intracranial hemorrhage types.
And as I understand, about 66 patients had a hemorrhage of the included 166 patients. Luckily, most of those were asymptomatic. Do you feel that 66 out of 166 is what we would see in clinical practice as well if we would scan all patients? Do we miss quite a lot of asymptomatic hemorrhages in patients treated with mechanical thrombectomy or with the combination of alteplase with thrombectomy or alteplase alone?
Sure. Well, when we will look at the recent trials that were published, and I'm thinking in particular on one trial I was involved that evaluates the blood pressure control in patients treated with mechanical thrombectomy. And when we look at the rate of ICH at 24 hours, it was around 40%. So I guess these are the numbers we may face in the current practice, or at least in the recent published trials. Outside, it's in the range of what we see.
So this is luckily the current practice. Patients who are reflected, and patients with an NIH a median of 12. So that also indicates that this is most likely to quite reflect well the normal population of patients with a stroke, with a severe stroke, who come in hospital and have acute treatments. One of the things, the treatment with the glenzocimab seems to be leading to very few hemorrhages, which is of course a great result to see. And with these results in mind, how do you think you want to move forwards?
So, of course, this was a pilot study, and we need to confirm these results. For this and to address this, we have an ongoing study, which is the ACTIMIS study. This is a phase 2b/3 study to confirm these results. And this study is ongoing and including patients again eligible for IVT and/or mechanical thrombectomy. And we will have another study we hope will start soon by the end of the year, which is the GREEN study, which is only evaluating glenzocimab in patients eligible for a mechanical thrombectomy. So only in this subset of patients where it seems, based on these results, that probably or potentially we may have an efficacy. Again, we need to confirm these results, and we'll see in these studies, ACTIMIS study and the GREEN study, if we confirm or not this is very interesting results.
Well, that seems to be very interesting. And in the next few years, we hope to get these results from these phase 3 and 2b trials to see if we can actually include this in clinical practice. I was thinking really out of the box when I was studying glenzocimab based on the abstract I read from your paper. Could we also use this, because you now study it really in the acute phase of stroke, but could we also use it as a secondary prevention agent? And has that been studied before?
That's a good point. For the moment, this drug is an IV administration due to its nature as an antibody fragment. Considering it for secondary prevention, then we will need another form of the drugs to be taken orally. This is another challenge. But I think that's a good point, in fact.
It was very interesting to hear from the ACTIMIS study. Congratulations on your work, and thank you very much for this interview.
Thank you very much.